All right, let's dive into this explainer. Every single day, we walk, run, bend, and lift, mostly without giving it a second thought. But right beneath our skin is this highly complex, beautifully engineered system making all that possible. Today, we're taking a deep dive into the musculoskeletal machine. We'll look at how it actually functions, what exactly happens when it breaks down, and the incredible evidence-based ways modern medicine and physiotherapy can rebuild the whole thing.
So, why do our bodies suddenly hurt? To understand why a simple movement, like just bending over to tie your shoe or reaching up for a high shelf, can suddenly cause intense pain, we've got to look at the mechanics of our internal structures. It's a situation almost everyone faces at some point, right? You move effortlessly for decades and then snap. Seemingly out of nowhere, something gives. But the truth is, it's rarely actually out of nowhere. It almost always boils down to biomechanics, cellular nutrition, and just general structural wear and tear over time.
Here is our roadmap for today. 1. The musculoskeletal machine. 2. When the machine breaks. 3. Diagnosing the damage. 4. Medical and surgical fixes. 5. The power of physiotherapy. And finally, 6. Prevention and prognosis. Let's get right into it. Section 1. The musculoskeletal machine. Anatomy as an architectural wonder. I like to think of this system as an absolute architectural masterpiece. In this comprehensive network, your bones act as rigid structural pillars, combining a really hard exterior with a spongy interior. Your joints are essentially complex hinges. Then you have ligaments providing crucial stability, tendons acting as high-tension cables transferring force, and your skeletal muscles, which are powered by intricate proteins, serving as the dynamic engines driving every single action you take.
Now, what's fascinating is that our musculoskeletal system isn't just for movement. It's actually a bustling biological factory. Sure, it gives us structural support, maintains posture, and generates force. And yeah, your ribs and skull protect your vital internal organs. But beyond that, deep inside the bone marrow, your body is churning out millions of new red blood cells every single second. Plus, your bones act as these massive storage vaults for crucial minerals like calcium and phosphorus. It's a seriously multifunctional setup.
Moving on to Section 2. When the machine breaks, understanding wear, tear, and trauma.
If we contrast two very common joint diseases, the distinction is really vital here. Think of osteoarthritis like mechanical wear and tear on a car's brake pads. Over time, that protective cartilage at the ends of your bones wears down, causing friction, pain, and stiffness. It's usually tied to aging, obesity, or past trauma. Rheumatoid arthritis, though, that's a biological glitch. It's like the car's own computer system attacking the engine. Your immune system gets confused and actively inflames the lining of its own joints. So, one is mechanical wear and the other is a biological misfire. We see a similar distinction when looking at soft tissues. Tendinitis is the inflammation of the tendon itself, those thick cords attaching muscle to bone, usually from repetitive overuse. Think tennis elbow. Bursitis, on the other hand, is the swelling of the bursae. Those are the small, fluid-filled sacs that act as little cushions to reduce friction between your bones and tendons. When those sacs get inflamed, trust me, every single movement of the joint can literally feel like sandpaper.
But, it's not all just everyday aches and pains. We've got to pay very close attention to the massive red flags. Symptoms like a suspected fracture, sudden paralysis, or severe spinal trauma, those require immediate emergency medical evaluation. Same goes for a loss of bowel or bladder control. That can indicate severe spinal nerve compression, which can actually lead to permanent disability if you don't treat it instantly. And a high fever combined with acute joint swelling, that could mean septic arthritis, a severe infection that can rapidly destroy joint cartilage. These are the moments when the machine needs emergency maintenance, no questions asked.
Section 3. Diagnosing the damage, the medical detective process. This diagnostic journey is basically a true detective story. It starts simply enough with your medical history, a conversation about your symptom timeline and lifestyle. From there, doctors do a physical exam to test your strength, check your range of motion, and analyze how you walk. If the picture is still a little fuzzy, they bring in the heavy machinery, X-rays for bones, or MRIs and CT scans for soft tissues like discs and ligaments. Finally, specialized lab tests can uncover hidden inflammatory markers lurking in your blood to pinpoint any autoimmune activity. Section 4. Medical and surgical fixes, the immediate interventions.
The fascinating thing here is how highly individualized treatments have to be based on the specific breakdown. Take a sedentary office worker with chronic neck pain. For them, treatment focuses heavily on posture correction, ergonomics, and physio. But contrast that with an athlete who just tore their ACL. The immediate focus there shifts to arthroscopic surgical reconstruction, followed by aggressive rehab. An older adult with severe knee osteoarthritis might eventually need a total joint replacement, whereas someone with sciatica might find relief through epidural injections and targeted therapy. The fix has to perfectly match the patient's lifestyle and their specific injury.
And that brings us to the actual interventions, the toolkit, if you will. This ranges from basic anti-inflammatory medications like NSAIDs and corticosteroids, all the way to DMARDs, which can actually slow down autoimmune damage. When medication just isn't cutting it, surgeons might use arthroscopy for minimally invasive joint repairs, or even do total joint replacements for severe degeneration. For traumatic injuries, we're looking at complex spinal surgeries and hardware fixations. It's a robust toolkit, and it provides absolutely crucial, immediate relief to patients suffering from chronic pain and immobility.
Section 5. The Power of Physiotherapy. Rebuilding the Machine.
Physiotherapy typically utilizes a two-pronged approach. Manual therapy uses hands-on techniques like joint mobilization and myofascial release to reduce immediate pain and improve early mobility. But honestly, that's just setting the stage. Exercise therapy is where the real magic happens. This empowers the patient with active stretching, strengthening, and core stabilization for a permanent recovery. Basically, manual therapy opens the window of opportunity, but exercise therapy builds the house.
Physical therapists literally use movement as medicine. Following strict guidelines from the American College of Sports Medicine, they systematically prescribe aerobic exercise for cardiovascular endurance and resistance training to rebuild those muscular engines. They also heavily incorporate flexibility exercises to restore range of motion, along with balance and proprioceptive training to prevent future falls. All of this is carefully dosed using the FITT principle, meaning the frequency, intensity, time, and type of exercise are perfectly tailored to heal your specific tissues.
This rehabilitation journey is incredibly evidence-based. From day one of acute care, you transition into early pain management and restoring range of motion by week 2. Then, months 1 and 2 focus heavily on strength and motor control before shifting into highly functional and balanced training by month 3. Ultimately, aiming for month 6 and beyond, the goal is a complete return to your normal life, sport, or work. It really is a marathon, not a sprint, getting back to full independence.
Finally, Section 6. Maintaining the machine, prevention and long-term prognosis.
The great news is you are in control of so much of your musculoskeletal health. By combining proactive habits like regular weight-bearing exercise and setting up ergonomic workspaces, you take a ton of mechanical stress off your body. On the nutrition side, giving your body high-quality protein, calcium, and vitamin D is absolutely essential for maintaining bone density. And if you add anti-inflammatory omega-3 fatty acids while cutting out smoking and excessive alcohol, you can dramatically alter your long-term prognosis, keeping your bones dense and your joints well lubricated well into old age.
We've seen just how intricate our anatomy is and how easily it can be compromised by wear, tear, or disease. But most importantly, we've seen how this biological machine has an incredible, almost unbelievable capacity to heal. The tools for recovery and prevention are quite literally in your hands. So knowing what you know now, what single change will you make today to protect your structural framework for the future? Thanks for exploring the musculoskeletal machine with us.